institution called as a biomedical waste. And this biomedical waste management is important as these biomedical waste have a hazardous potential. And if we do not manage well, it will cause an infectious hazard to a community as well as to every single community person. So these biomedical waste guidelines to whom we can apply. So every person who are handling or with a contact with the biomedical waste, that is healthcare workers, those are doctors, nurses, or any cleaning staff also, as well as patients and relatives are come with no contact with the biomedical waste, and they should know about the biomedical waste management, how to treat this biomedical waste. And where it get generate this biomedical waste. So basically, the most of the time it's a hospital, nursing home, clinics, but it also get that veterinary institution, animal houses, laboratories like pathological laboratories, blood banks, health camps, medical and surgical camps, vaccination, and during the first aid room in a school also. So every waste which get produced in a hospital is not a biomedical waste. So we need to know what exactly biomedical waste is and what is non-infectious other waste, that is general waste and other non-infectious waste. So here we should know what is general waste, that is dry waste, wet waste, demolition waste, that is construction and demolition waste, and some e-waste also get generated at the hospital or the clinics. These are non-infectious waste like batteries, e-waste, radioactive waste. But these non-infectious waste need to manage by different rules, and there are various guidelines submitted by the government. But this biomedical waste, which is an infectious one, we need to handle by the Biomedical Waste Management Rule 2016. So coming to the Indian scenario of this biomedical waste, almost 774 tons per day biomedical waste get generated. And among that, the 708 tons per day get treated or get managed according to the biomedical waste management guidelines. So coming to the hazards of this biomedical waste, if we see the worldwide scenario, most of the time the blood-borne infections, that is hepatitis B viruses, hepatitis C viruses, as well as HIV infections, get this mismanagement of biomedical waste. And if we look at this, the percentage, almost 32% to 40% of this infection of hepatitis B, hepatitis C, that is blood-borne infection, get during the handling of biomedical waste. That's why this biomedical waste have an potential hazard of not only for a blood-borne infections, but by with the multi-drug resistance organism also. So we should be cautious during handling of this biomedical waste. That's why it's very important to know the guidelines of this biomedical waste management. As we can see that every hospital waste is not a biomedical waste. The general waste and other non-infectious waste is almost 85%. If we see at this picture, the only 15% of this hospital waste is a biomedical waste. And if we do not manage well, if this biomedical waste get mixed with this 85% of non-infectious waste, there will be a huge, tremendous potential of hazards, as well as there will be a financial burden also to manage with this biomedical waste. So we should be very cautious regarding this biomedical waste. And as we have seen the figures that how much this biomedical waste will generate. So this is our responsibility that we should reduce the biomedical waste generation as much as possible. And every biomedical waste is not, we cannot dispose, as few of them, the biomedical waste haven't some toxic materials like plastic. If we burn it, generate the toxic fumes. So rather than just burn it and get disposed with the plastic, we can recycle it. So from biomedical waste, we can recycle also. So for that part, we should go for, and as much as recovery is possible from biomedical waste, you can try for this recovery also. And if there is no option, then we can go for a disposal for this biomedical waste. So how, where it get generated, we have seen. That is the hospitals, clinics, healthcare facilities, where it get generated. And this biomedical waste need to get treated, make it into a non-infectious waste, and then we should get, we can recycle it. So there are two facilities where the generation is, that is hospital and healthcare facilities, and where it gets treated, that is common biomedical. So common biomedical waste treatment facilities, that is CBWTF. So here in a hospital or any healthcare facility, there are few steps we need to follow during this biomedical waste management. There are segregation, collection, pre-treatment, intramural transportation, and storage, where we all doctors and nurses almost comes in a at this state, that is segregation. So for segregation, we should know how this biomedical waste should get segregated, and if we segregate it at the point of generation only, that we can reduce the mixing of the biomedical waste and the management will be easy. So these steps, that is segregation, collection, pre-treatment, and intramural transportation, we will see in a detail later on. And after this generation at healthcare facility, it goes to a common biomedical waste treatment facility, where it makes convert into a non-infectious waste by incineration, autoclaving, microwaving, deep burial, and effluent plant. These are the processes or treatments to make it non-infectious. So at Nashik place, we do have a water grace company which take care of this biomedical waste, which collect the biomedical waste from different healthcare facilities. So for segregation part or segregation step, which is very important step, where we almost all doctors and nurses are dealing with, we should know how it should get segregated. So for biomedical waste management guidelines, it has given the 4 categories for segregation. These are color code segregations. So we should know the color codes for this segregation of biomedical waste. These are yellow, red, blue, and white. In yellow color categories, the anatomical waste, chemical waste, soil waste, chemotherapy waste, discarded linen, medicine, and laboratory waste can dispose of. The contaminated plastic and rubber waste we can discard in a red category. Glass waste and metallic implants we can discard in a blue category, whereas all kind of sharps we can discard or dispose in a white category. Coming to a yellow color code category, here we can discard the human waste, animal waste, soil waste, expired or discarded medicine or pharmaceutical waste, antibiotics, cytotoxic drugs, including container, chemical waste, discarded linen, contaminated with blood, body fluid, or other any kind of secretion of patient, then microbiology or any clinical lab waste. Along with that, here the important points come the blood bags and live attenuated vaccines also. If we look at this category, we can discard it in a yellow container. That yellow container should have a yellow color bag inside, where we can discard soil waste, linen, contaminated linen, the mask, the anatomical waste, microbiological or other laboratory waste, blood bags. Because bloodborne infection risk is higher on so that yellow category, where this yellow category go for incineration, we should discard this blood bag in a yellow color category. Along with that, the blood containing vacuum also. Coming to red color category, this is also infectious material we can discard in a red color category. Infectious material, but that material should be recyclable. So the plastic items as well as rubber items we can discard in a red color categories. Red color category, that is catheters, tubes, bottles, IV set, Euro bags, pipette tips, gloves, syringes or vacuum cleaners without needle. So if you look at these two things, that is gloves. Gloves are made up of rubber material. So normally gloves should go in a red category. But if gloves are contaminated or soiled with a visible blood or any kind of infectious potential, infectious secretion, we can discard these gloves in the yellow color. Along with that, syringes, always we get a question of syringes. If the needle is detachable, then we should detach the needle, and that needle part goes in a sharp waist, that is white category, in a red color category. So here for red color category, that waste material we can discard in a red color container. Along with that, inside there should be a red color bag. So gloves, tubings, Euro bags, catheters, saline bottles, and syringes without needles we can dispose or discard in a red color category. Now coming to white color category for biomedical waste. Here the sharp waste excluding glassware, that though the glassware can be a sharp product, that should go in a blue color category, whereas the other sharp goes for discard in a white color category. So these are the metals, especially the needles, and those syringes, these syringes made up of the polypropylene, that is plastic, but they haven't the sharp waste like needles, fixed needles. We cannot detach the needles from the syringes. That can go in a sharp waste, that is white category. Scalpels and blades. So this type of white container we can use to discard the sharps. Here we do not use the white color bag. Here only we use the puncture-proof, needle-proof white container. So here the syringes with fixed needles and other kind of the scalpel and blades, sharp category, goes into white category. And then blue color category, here all broken or unbroken glasses as well as the metals like body implants, okay, and glassware goes into blue color category, where we can use the blue color container along with the blue color bag inside, or only a cardboard box but having a blue color marking can also utilize to discard this glass and metal color material. So implants and glass bottles. So we have seen the color coded categories for biomedical waste disposal, but these are at the segregation point where we segregated this biomedical waste. Now segregate or generation point, this biomedical waste to collect, and it has to collect it at a central storage area of healthcare facility. So these collection mostly get collected by the cleaning staff, okay, or class 4 people. Okay. So they should know the collection, how it should get collected. So general instruction will all healthcare workers should know. So general instructions or guidelines for collections are, it should get collected on a daily basis. It should get segregated well in a color-coded categories. And during collection, the appropriate PPE should wear, and the precautions not to get any kind of injury or in contact with the biomedical waste. We should take those precautions, especially during the handling of sharps. And while collecting these, we should take a precaution that these color-coded bags should not be a full of this bag. When this bag get full 3/4, that time only that bag should get tied up, and this bag never should be stapled. These bags should get tied properly and then should get collected at the appropriate color-coded trolleys. Okay, and these biomedical waste bags also should label with the proper details and bio step. At this collection step, that packaging should be proper and labeling also should be proper. The labeling with the details such as date of generation of biomedical waste, the collection of biomedical waste, type of waste, quantity of waste should be written. And these labels with the biohazard symbols. Okay, these labels should be non-washable and prominently visible, and it has to stick on a biomedical waste bags. Now, after collection, they should be transported to a central storage area. During this intramural transportation, we should use the covered trolleys. In figure, you can see a covered trolleys or cars, and this should have the separate passage for these trolleys, and should have a low traffic area where patients and visitors route should not be from a same site. And this get transported to a central storage area. That storage area, how that storage area should be available at a hospital places or in healthcare facilities. That details guideline has been provided, but the general points I'm just discussing here. That central storage area should have a lock and key. The space should be sufficient. That storage area should be away from the public, and that area should be well ventilated. The floor of that area should be easy to clean. It should have a water facility and it should be rodent free. Okay, and the most important point, the biomedical waste which get collected at the central storage area should not keep more than 48 hours over here. After storage at the central collection area, the common biomedical waste treatment facility, those get collected, those collected this biomedical waste and the collected from the different healthcare facilities in the city. And this biomedical waste get treated by different processes like autoclaving, microwaving, incineration, or landfill or pyrolysis. So which category and how it should get treated, I will just enumerate. So yellow color category, which is an infectious one and have a non-plastic material, and those material we cannot recycle, these yellow color category waste should get incinerated at 1200 to 1800 degrees Celsius, and after incineration, whatever the ash has been get produced, that ash should get landfill. Whereas the red color category, which have in plastic as well as the rubber material, which we can recycle. So it should go for a recycling, but before recycling, it should make a non-infectious one with autoclaving, microwaving, and after that shredding, it get into a non-infectious waste, and that non-infectious waste can go for a recycling factories. Here, the red color category, we have seen the waste go for a recycling. Whereas blue color category also having metallic implants and glassware. That material also we can recycle. So like in red color category, here also these metallic implants and glassware get processed by autoclaving, microwaving, hydroclaving, such type of processes and go for a recycling. Whereas the sharps waste, we make it as an non-infectious by autoclaving and microwaving, and we cannot recycle because it has a tremendous potential hazard. So we directly landfill it. We do not recycle the white color category. So all these categories we treated, those were about the solid waste. Now we will just look at for a liquid waste, which is infectious. We also call it as biomedical waste only. So for this liquid waste, liquid biomedical waste, a effluent treatment plant should be there at every healthcare facilities. And that effluent treatment plant having three types of level treatment processes. That is primary treatment with different chemical processes like equalization, neutralization, precipitations. Secondary treatment with the aerobic biological treatment, and tertiary treatment with the pressure filtration and disinfection. And afterward, it just dispose it in a drainage or sewer. So this is the just a diagrammatic presentation for this three level treatment of effluent. Now these guidelines, regarding these guidelines, just the which are there the advisory committee for this biomedical waste management. We'll just have an overview. The Central Pollution Control Board, that is a central board, okay, which is in a coordination with the every state government and union territory administration. They make the advisory committee for national level for biomedical waste management. And those areas which are not under the central government or a state government, such like a Ministry of Defense, here the Central Pollution Control Board, along with the Director General of Health Services of the Armed Forces, they do make an advisory committee for biomedical waste management at their places. So we have seen the regarding biomedical waste steps where it gets generated, the definition, and our duties to at the segregation level, how we should segregate the biomedical waste. So for me, this biomedical waste management, just to conclude this biomedical waste webinar, I will just give you a few key points. So for take home message, the segregation is a key step where we healthcare workers, especially doctors and nurses, they handle at this place. So biomedical waste segregation is a key point where we can responsibly, with the responsibility, we can act and segregate the biomedical waste properly. That will be the beneficial step. Then we can recycle and recover the biomedical waste as much as possible. And obviously through this recycling, we have both beneficial benefits like the toxic product which get generated after management of biomedical waste. We can reduce that, as well as we have a good recovery. To manage this biomedical waste, we should have precautions with the hand hygiene and personal protective equipment that we should take care of, because to reduce the chances of blood-borne infections to patients, relatives, as well as to healthcare workers. As a segregation is a key step, I just again revise the color-coded segregation. That is, yellow color category is an infectious but have a non-recyclable material and which are highly hazardous, so we should get incinerated. The red color category have an infectious but the recyclable material which we can recycle and recover. The metal and glass, that is also recyclable waste. So red color category and blue color category we can recycle. The sharps, we should have proper precautions with the sharps. We can discard the sharps in a white color. So these are all about the biomedical waste management. If any further query or questions are there, please you can write it in the chat box or unmute yourself